Nurse.org and Major League Sports teams are honoring nurses with discounted game tickets and once-in-a-lifetime experiences. From throwing the first pitch to riding the Zamboni to on-court recognition, join the fun. Visit nurse.org/nurse night to find a nurse appreciation event near you and grab your discounted tickets today. You're listening to Nurse Converse, presented by Nurse.org, a collaborative podcast amplifying diverse nurse voices. Get ready for a dose of inspiration, a sprinkle of education, and a whole lot of community.
Welcome, Nurse Converse Universe. It's great to see you. My name is Dra. Tina Loarte-Rodriguez. I am one of the proud podcast hosts, which you voted for. And I'm so excited to be back here today with these two fabulous human beings that I cannot wait for you all to get to know a little bit more about. So it is my pleasure to welcome Dr. Sabrina Ali Jamal-Eddine and the fabulous Miss Andrea Dalzell. So welcome, queens. And I will let each of you give a little background about yourselves because y'all fabulous and I can't do the justice that you can do. So Sabrina, I'll let you go first.
Sweet. Thank you so much for having me here. I will start with a visual description. I am an Arab woman with dark brown curly hair. In the background, I have a keffiyeh and a sign that says fund care, not killing. I am wearing a green shirt and I am in an accessible seat. But yeah, my name is Sabrina Ali Jamal-Eddine. I am an Arab disabled queer woman, health humanities nurse scientist, and postdoctoral researcher in the Department of Disability and Human Development at University of Illinois Chicago. I did my PhD in nursing here at UIC, where I researched the use of spoken word poetry as a form of critical narrative pedagogy to educate nursing students about disability, ableism, and disability justice. I am an Emerge Disability Justice Fellow through Paul Longmore's Institute on Disability, and I am happy to be here and be in conversation with y'all, so thank you for having me.
I said, how am I following up? Like, oh my goodness. Whoa. My name is Andrea Dalzell. I'm affectionately known as the seated nurse, as I'm the first nurse to go through nursing school in New York State with the use of a wheelchair. I'm also known for 76 clinical rejections while trying to find clinical placement as a nurse using a wheelchair, and then now redefining what disability means in healthcare through practice and through patients. Also, just trying to navigate this New York City life. It's a concrete jungle, and also making sure that healthcare reaches all of those that use wheels out here.
Love it. Thank you. And I appreciate kind of the context of setting the narrative, right, for this important discussion we're having today. So in addition to my name, I would like to say that I use she, her, ella pronouns. I'm a proud Afro-Latina Boricua from the Bronx. So we got New York in the house. Really excited about being able to use this platform to continue to elevate these powerful stories of strength. That was one of my commitments when I became a podcast host, was like, I want to continue to ensure that stories of triumph, right, and the other areas of opportunities within nursing and healthcare are elevated. So when I had the privilege and honor of meeting you two back in October at the DMPs of Color Conference in Philly, I was like, oh, I need to connect with you. I need to learn more from you. But also I want to have you share with the Nurse Converse universe, right, more about your stories and your message. So with that, we're going to jump right in. And I want us to get to know a little bit more about kind of your story into nursing, right? And how did you come to have your experience, your expertise, your passion, right? Like what was that story for each of you? And Andrea, I'll start with you this time.
Oh man, really? Listen, I did not want to go into nursing. And that's my honest truth. There was, there's some of us that have that innate passion and jump right into the profession. Some are, for lack of another term, groomed by their family who's been in nursing, right? Like you kind of catch the bug very early if you have familiar around you that are in the profession or even just in healthcare. It kind of just bites you. But I did not. I actually wanted to be a lawyer at first because as a child, I was diagnosed with transverse myelitis, which is a spinal cord illness that affects the neurons and the nerves. So I was left a wheelchair user by the time I was 12. And I had told my doctors and everyone else that I was going to come back and sue them for all the pain they ever put me through. That's what lawyers do best, right? They advocate. Now, fast forward, decided that I was actually going to go to medical school instead because if you can't beat them, you join them. So I had this fictitious idea to cure pain. I don't know if it's so fictitious anymore because, medical advancements every day. But in doing some auditing of classes, I realized that the medical model wasn't for me. Looking at a patient as though they're just the disease process didn't sit right with me. And one of my own nurses said, well, why not nursing? And if I was being very real with myself in that moment, and never thought that any of my nurses would have a disability, whether invisible, and I knew definitely not visible. So when I started asking around the college nursing department saying, hey, I want to be a nurse, they were all like, we've never seen a nurse in a chair. And I just decided one day to take the leap of faith and say, you know what, I'm just going to apply and fight if I have to. And that was that. Nursing.
We'll get more into that. We'll get more into that.
All right. Like nursing became the one that I fought for. So hey.
Awesome. So proud of you. Thank you. Sabrina?
Yeah, so this is Sabrina speaking. Okay, so I did go into nursing, like I wanted to go into nursing. I don't have any family members in healthcare, but my disability experience is what prompted me to go into nursing. So yeah, my experience with disability and nursing is I have a congenital connective tissue disorder, but I didn't formally join the disability community or disability identity until I underwent a 12-level posterior spinal fusion with 2 rods and 18 screws for curvature in my back. That failed and left me with 24/7 breathing pain. I was one of over 500 patients who experienced a failed surgery by the surgeon. I took a year off in between high school and college, a medical leave of absence to undergo a 12-level revision spinal fusion where they removed my 2 rods and 18 screws and inserted a completely new set of properly contoured hardware. And the minute that I woke up from my revision surgery, I didn't have the 24/7 breathing pain anymore, but I still experience breathing pain daily related to a couple screws in my back and my connective tissue disorder. For me, having accessible seating and limited lifting are the accommodations that work best for minimizing my pain, but I live in my body every minute of every day, so I know what flares my pain and what doesn't. I know what I need and what I don't need. After my year-long medical leave of absence, just having so much lived experience with nurses as a patient and deeply understanding the importance of access to healthcare related to experiencing 24/7 breathing pain, I decided I wanted to become a women's health nurse practitioner. So I did a year of pre-nursing coursework, applied to the major, made it in, started my first official nursing courses, and at the bottom of every syllabus, it asks us to come forward if we have a disability. So I have multiple very well documented disabilities and knew what accommodations I needed within clinical. But after coming forward, I was asked why I entered a major I was not physically capable of participating in. I was handed a list of technical standards, basically told if there's anything on this list I can't do, that I can't be there. I was offered another year-long medical leave of absence for a permanent disability, which doesn't make sense. And I was required to provide a letter of permission from my surgeon, granting me permission to stay in the major. And then my surgeon, gladly provided the letter. But this experience of ableism was hands down one of the most traumatizing experiences of my life, being punished for something I had no control over, despite knowing my capabilities within the profession. After providing the letter, I felt unsafe, like they could weaponize my disability and dispose of me at any minute. and I felt like forced to remain silent the rest of my time in the program, didn't have relevant accommodations, like they weren't in clinical. Then I learned that so many disabled nursing students have the exact same experience that I do. This is not isolated at all to any program. This is happening across the country at every single program. So that's why I went into my PhD in nursing, so that I could study ableism in nursing education and practice. And so that's why I'm here now.
Amazing. And quite disturbing, right? To hear how a caring profession, right, nursing, has not become inclusive. And to your point earlier, Andrea, about visible and invisible abilities, it's just really disturbing, right? And actually, I'm just like mad. I'm like, wait, whoa, like, what are we going to do next? And we're going to get to that too. But a theme that I picked up from the two of you was pain, right? And so that's really touching to hear that you personally have physical pain, right? But then I can only imagine the other types of pain you have experienced, both in trying to become a nurse and then now that you are nurses. Can you share a little bit more about that? And with that, what are your call to actions, right, for us to recognize that and to be able to be allies and advocates for nurses with various disabilities and or abilities?
I think for me, I stopped at the point I start my story like going into nursing school, right? And it's not stated that my first day of class, I wasn't presented with a list of anything. It was told to me that hospitals weren't going to accept me in the nursing student position. And I said, why? Are you going to single me out as someone with a disability? Like, aren't hospitals equipped for people with disabilities? And their faces just were astonished. They couldn't believe that I would even say something back. But it was the reality point. Aren't hospitals and clinics supposed to be for those with disabilities? How is that now become an oversight by those of us that are actually given care? And then why aren't we then including our advocacy to ensure that access is available? We've missed that cornerstone of our whole nursing education, competence, right? Like to be listening, to understand. And it's one thing to pass the NCLEX, but it's another thing to understand empathy and understand that this position in itself is supposed to be an open door policy for anyone to seek care. And instead now, I call it nurse magic, and I don't know if anyone's ever heard me say this before. Our nursing magic is dimmed because we're dimming it ourselves, because we're here bringing people back from the brink of death, if not death itself, from our ER nurses, our ICU nurses, and then we transcend their lives by being in their home with our home care nurses, right? The ones that are coming and checking in on you. Then we have our occupational health nurses, the ones that are keeping us healthy at work. We have our school nurses who are keeping our kids healthy every day, making sure that they're able to just survive every single day. We're giving them a piece of ourselves just to be. And then we close the door when they have a disability. How is that possible? Our magic is coming back to us. Everything that we've put into these people now comes back into the profession saying they want to be like us, helping other people. And we're saying, no, you're too disabled, point blank.
Hey nurses, looking for exclusive discounts? Nurse.org has you covered with deals on everything. Save big on the essentials you need to excel in your career. Don't miss out. Visit nurse.org/discounts for the latest discounts made just for you.
I would say, in terms of like the pain, that the experience of ableism creates so much pain for disabled students, and like healthcare and nursing should not be manufacturing pain. Like what I understood nursing to be when I went into it is we are alleviating pain and healing and understanding like the violence that ableism, racism, classism, homophobia causes to marginalized people. Like there's a bunch of studies that these physiologically harm marginalized people. And so not just patients, but also like students and healthcare workers, we need to be really committed to like dismantling, reproducing that pain. But I think what the nursing profession is is moving away from and needs to move towards is like humanization. Like, I don't know, it just feels like there's been a lot of dehumanization, and that's what facilitates this violence against marginalized people. And yeah, we need to take steps towards moving back towards it, recognizing that nurses are humans too and have lots of needs, and all nurses have needs, and we need to work on those.
Right. No, very, very poignant points, both of you, and the power of empathy, right? And that, again, is the root of our science, of our profession. But yet, somehow between, I don't know, technology, political climate, reimbursement, right? Like, that has kind of been extrapolated, right? And forced out even to a degree, when we can't even see each other as humans, first and foremost. Thank you for those insights and for those reflections. Related to kind of the systemic barriers, right? What, I guess, call to actions, recommendations do you have for us, right? And for those who have the power and privilege to really enact true change? What would be your call of how we can address this? And as you say, right, our pipeline is vast, from education to the numerous places where we work. Yeah, with that, what are your thoughts? What do you think we need to be working on?
I would say making spaces accessible cannot be optional, and it reflects the values of an institution when it's optional, when exclusion is normalized and practiced. I think institutions can put their money where their mouth is and commit to unlearning ableism, racism, classism, homophobia, sexism, transphobia, Islamophobia, censorship, repression, political disengagement. Like, the current approaches to unlearning prejudice, I don't think are effective. Like, currently it's these trainings that are checking a box off. So these institutions are saying, well, our employees went through this training and did this, but it's clicking a button on a screen. It goes back to the dehumanized, and what Andrea and Dr. Tina, you were talking about, just in terms of like empathy being decentered in curricula. Like, it's so much like obsessing over clinical skills, but not putting attention to these other aspects of nursing that are just as important and create safe care. Like, empathy is needed to create safe care. So yeah, I think like the types of trainings and approaches that we use to educating people about these need to be rooted in storytelling and art and approaches that work at humanizing people. And that's like what my research has focused on thus far. Like, we need space to tell our stories of disposability and our imaginations for belongingness. Institutions can identify themselves and like prove themselves through material action as a safe space. Like, they can measure their effectiveness through anonymous workplace and patient satisfaction surveys, through hiring disability resource professionals who specialize in clinical access. So like, what I was stuck with was not having anyone who knew what a clinical accommodation could look like. So that doesn't happen. Making sure their workforce reflects the identities of the population they're serving. So if disability is 25% of the population, then the nursing workforce should also be 25% disabled. And racial diversity, like, it needs to reflect the area that we're around, gender, sexuality. So yeah, just making sure there's like representation across all levels and positions. So not just representation on PCAs, patient care assistants, like sanitation staff. It needs to be like in all roles. And then investing in universal design, I think. Make the space and policies more accommodating and accessible for all nurses. Build flexibility in through float pool staffing to better allow for like sick days and pain flares for disabled people, family emergencies. Nurses are part of their own care webs outside of work.
Yeah.
I have a bunch of other things I could say.
That's amazing. Hope y'all got all those notes. She just dropped a whole bunch of knowledge there of things that you can be doing to ensure your settings are inclusive.
I think I'm going to take it back a little bit. I think even to my students who are listening, my nurse educators, understanding that even the prerequisites can be a barrier to getting to the door of nursing. That's first, right? Chemistry is not always accessible, and chemistry brings up a point of being, safe in an environment where chemicals are being had first, right? And there's this constant point to prove yourself when you're put in a situation where you're choosing your education, and people with disabilities know their limitations already, or they at least want to explore what they are. But you have to give them a safe space to say, yes, this works. No, I don't feel okay doing this. Or give them an option to be able to talk it through, write it up, have a partner. Like, there's so many different ways, but barriers start before we even get in the door to education. We have doctors who are writing up our forms. So you heard Dr. Jamal-Eddine speak on how, like, she had to have a form and stepping outside of our ethical practice to say, well, if you're coming for employment or if you're coming into this educational system and I'm asking you to fill out a form, I am not now changing the narrative to say, well, you can't stand for 12 hours, but you can sit for 12 hours perfectly fine. So I'm going to put that down instead. Instead, I'm going to make it so that the narrative speaks in a negative to the person reading it versus the positive. And I understand for all of those who are also listening that are directors, I know your budget. I get it. Your budget's going to be blown if you have to do something else. No, it will not, because your institution needs to file the right grants so that you can get the information that you need and also get the spacing that you may need to provide, whether this is an educational sector, whether this is in private sector or in healthcare, it works the same way. So we need to break this narrative that we can't do it. It hasn't been done before. We know in nursing that we are the innovators of healthcare. We see it, we think about it, we make it happen. We come up with the most random things to make something work, especially when it is critical time periods. And that's one of those time periods now. Things are changing. Everyone's hung up on the word of inclusion or DEI. We all don't want certain things, but I'm just going to call for you guys to just change your negative to a positive when you're writing about a disability. I'm not adding toxic positivity here. I'm just giving a way for people with disabilities to make a path for themselves and hold other nursing professionals accountable to inclusion on everything that Dr. Jamal-Eddine listed out for you guys to just replay that part.
Play it back and put the subtitles and closed captions on so you get other notes. We'll get the transcript out there too.
I want to add to that. This is Sabrina speaking. I just yes, emphasize what Andrea is talking about with approaching disability through innovation. If you cannot think of a solution to increasing access, maybe you're not aware of the adaptive technology that exists. But talking about cost, it's going to cost a lot more to hire, onboard, and orient a new nurse than it will be to adapt, innovate, and reroute. Not jumping to disposability for a disabled nurse. If we are talking about cost, which flexibility is key, and we should not be centering profit over health ever. But and that leads to fixing the nurse to patient ratio, which causes problems for all nurses, disabled and non-disabled alike. It's because of the massive income inequality that exists for people in extremely high positions of power at hospitals are causing these harmful nurse to patient ratios.
Amazing stuff. And we're just coming to close to wrapping up. So any last words of wisdom or anything else that you want to end to the listeners out there to share, feel free to do so.
I think my empowerment moment is to pick up a book this year. Okay, like read something that is going to change the way you think about disability. There's so many good books out by disabled writers, or even just a history of it. I think that it's very important to get back to the root causes of why we do the work that we do, and you can't do that without knowing the history or hearing or listening to other stories. So yes, thank you for listening briefly to our stories today, but really grab a book, reach out, watch YouTube, listen to more podcasts, especially here on Nurse.org. But at the same time, just really understand that disability is encapsulating and there's so many stories to be had. One story is not the same as another's. That's why we have to take off these rose-colored glasses thinking everything's okay. Like, we're nurses, we fix it all, and we need to fix this now.
I definitely want to echo what Andrea said with reading. That's the most liberating action you can take. Commit to unlearning and learning. From birth into this society, we're taught to assign more value to certain bodies over others. We need to unlearn that. We need to listen to stories, immerse ourselves in art created by people who are experiencing oppression so that we can better understand that oppression and better humanize the people we've been taught to view as less human. I would advocate that we switch from a rights-based approach to a justice-based approach. Laws rarely protect those who are most marginalized, and we're learning right now that laws are not protecting us. Lean more deeply into transformative action. Don't fear engaging with people and concepts that have been politicized. A lot of things are not complicated if you ask yourself, does this support or work towards dismantling white supremacy, colonialism, and capitalism? You can't talk about ableism without talking about those three things. You can't talk about any issue that is politicized without talking about those three things. And just a reminder that nursing is about valuing and protecting health in the human body. It's about healing. It's about care work. And it's about equity. So I would advocate that you don't make those inseparable from your work. Your silence on injustices within and beyond the U.S. are inseparable from your work. So advocate for those on a local setting within your workplace, and then also on a global setting.
As is our ethical duty, right? And we just got updated ethics. So I cannot thank the two of you enough. This has been profound. You dropped so much knowledge and just highlighted so many areas for us during this brief conversation. So make sure, everybody, that you follow these two lovely ladies, because they're powerhouses. They're going to keep shaking and transforming things up, as well as check out the Nurse.org article that's going to have a lot of supplemental information on these topics. Again, thank you, the two of you. I wish you nothing but the best, and always know, whenever you want to come back, we're happy to have you to share some more wisdom.
Thanks for joining Nurse Converse, brought to you by Nurse.org. Help us grow by leaving a 5-star rating and review on your favorite podcast platform. Nurse.org supports nurses with career and education tips, life advice, and breaking news. Thank you for all you do and for being you.